So I'm gonna try to move this a little quickly so we get caught up here a little bit, but you're gonna hear advice from many of us this morning, and some of this may overlap, but just as you're starting to plan ahead for the next few years, some things to keep in mind. First of all, there's a lot of resources for you. We'll be able to get you copies of these slides, Neurosurgery Match, the Society of Neurosurgery, NRMP, AAMC, AANS medical student chapters are a good one. Let's look at the data, and you saw some of this. There's really good data on matched versus unmatched applicants. This is from last year. Matched board scores 245, how many programs contiguously ranked, research experiences, AOA for those available. All this data is out there for you to look at if you would like to gauge where you may fall with all of this. The probability of matching does not really go up after about 17 or 18 contiguously ranked programs, just to keep that in mind. That's evolved a little over the last few years. Here's the step 1 scores and the distribution of matched versus unmatched people. It's a pretty natural Gaussian curve, but you can see the differences there. I'll talk about cutoffs in a minute here. Here's abstracts, presentations, and publications of allopathic seniors. And most of the matched ones, as you'll see, have 5 or more. You keep that in mind moving forward, and we'll talk about why that is. This is not just for neurosurgery, this is for the entire match. The good news is about half of people get their first choice, which is pretty good. And then you can see the rest of how it breaks down here. 16% go beyond their 4th rank. So the odds are pretty good overall. There's actually a list of what program directors care about when we look at applicants. And I know you can't see all this, so let's focus on the top couple. Number 1, you may be surprised to see, you may not, interactions with faculty during the interview and visit. Okay? You can't replace human interaction with anything else like board scores. If you're going to be spending 7 years with people, that dynamic is the most important. Number 2, very similar, interpersonal skills, interactions with house staff. So the first 3 are interpersonal dynamics. Feedback from residents, also similar. And then finally, the board score gets dropped as number 5. Okay? And again, that's more of kind of a, as Dr. G mentioned, more of a litmus test. Here's some step 1 and step 2 board scores, and when they poll program directors, here are the quote-unquote cutoffs. These are not always absolute. There are exceptions to